How you doing, peeps? I just wanted to do this little video and talk about a particular patient that I saw recently. This patient came in with knee pain, and this was going on for quite a few months. And one of the things I generally always ask in a consultation is, what are you finding difficult to do, and how is it affecting or impacting your life? And I was told that the patient couldn't squat. She didn't want to squat or anything like that. She had seen various different people and with no success. So she was getting sort of quite down about what was going on in the pain. Obviously, when you're in pain for any certain length of time, it can obviously make you feel not the best. So anyway, digressing a bit. So as I'm doing my assessment and talking to this patient, one of the things that came across to me very clearly, very quickly, was that there was a lot of fear that was going on with this particular patient. Again, it's totally understandable. When something hurts, you don't want to do anything that's going to make it worse. So I did my examination, did a bit of palpating. There was some tenderness around the front of the knee. But one of the things that this patient was really scared to do was squats. She didn't really want to bend down, and the knee was really quite painful. And as I was chatting to her and just talking to her, one of the things I got to do was a squat. And when she went to perform the squat, I could see the fear that was on her face, and she really braced herself. And when she did the squat, there was some pain, and I went, right, okay. So I stopped her there, so I didn't make her go any further. So again, did a bit of treatment, and as I'm talking to this patient around what I think was going on, I didn't think there was anything structurally wrong. There was a bit of sensitivity obviously on the knee, but this patient think there was ligament damage, there was tendon damage. From my examination, there was no damage to the knee. So did a bit of soft tissue work, did a bit of articulation through the knee and a bit of the hip as well. And at the end of the session, I re-examined and I got the patient to do a squat. And as I was talking, she was able to squat down without any pain. So before she went to squat, I could see the fear in her face, and I said, don't wait for the pain, because if you wait for the pain, you're going to just psych yourself up, and as you do it, you will go down and you will start to feel the pain. So when I said to her, don't wait for the pain, she did a squat with no pain. So the squat she did was body weight, but she was able to do it with no pain after the session. So we had a follow-up session a week later, and I said, how's everything been? And she said, knee's been great. I've not had any pain in the knee whatsoever. I'm able to go back to the gym, do the stuff that I was doing in the gym before, squats, lunges, going out for walks. This patient wasn't doing any of that because she thought the knee was damaged. So what I did as an osteopath, I did what I usually do the treatment and the manual therapy, but I think most of the success came from good outcome for this particular patient was giving her confidence to actually go out and do stuff, but say that she could exercise, because one of the things that was holding her back, that she didn't want to exercise, but she thought it was going to cause more damage, which wasn't the case. It was it was an avoidance issue that was going on with this particular patient, and I just gave her the confidence to go out and do the things that she likes doing. And one of the things she really likes doing was exercise. So she was able to do that, and now she's exercising without any pain, and she's happy. So my point of the story is this: when I'm assessing patients, I always try and think about what's going on, and genuinely a lot of time it's coming down to sort of reassurance. I'm not saying this is going to work for every single person that you will see, but for a lot of the people that I've seen over my time, is just giving them the confidence to go out and exercise, because exercise is one of the best things you can do for your body. Because as anyone who follows me, you know one of my favourite slogans is motion is lotion, rest is rust. So all I'm saying to you guys out there, if you want to, when you get patients in and they've got issues, just assess it and see if it's all fear driven, and if you can get them moving with confidence. Sometimes you're going to have to modify the exercise, change it up, just do something a little bit different. But the thing I'm trying to do is trying to get people not to avoid things, because when they start avoiding things, it doesn't actually help anything. It just, in some cases, it can create more issues. Hopefully that helps. If you've got any questions, you know where to find me. See you later. Hope you have